This is the Civilian Medical Podcast. Listening to a podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast. Listening to podcast is no...
All right, I got it. Whew. I would like to say that we don't need Sean, but I just played the intro 3 times, so we may actually do need Sean. But at least we have an intro music this episode. This is the Civilian Medical Podcast, episode 74, and I've got my co-host Bobby here from Texas. So this is 2 in a row that we've made. So I think we're on is it a streak yet? But we're getting there.
It's going to be a habit soon.
We're getting there. So we've already got a plan for next month and a month after that. So we're rolling with this. This is good. Got you a better setup, I think. Maybe it was my internet, your camera. I don't know. But hopefully you don't glitch out as much this time. So
seems pretty smooth so far. I'm excited for today.
What are we going to talk about?
Let's talk about combat sports. So let's talk about it 2 different things. First is this is a civilian medical podcast. So we'll talk about what does it look like to respond to injuries from combat sports. And then the second part is we'll talk about is there a benefit or a role for combat sports, martial arts for first responders to train themselves. So I think that'll be interesting. But first, we should follow up from our episode last month because we had a great episode on aviation emergencies with some technical issues. But after that, it kind of hit pretty close to home for us because we had a mutual friend of ours, a medic that we work with, who was involved in he's a flight medic, and his helicopter dropped some patients off at the hospital, took off, and crashed into the woods. So within a week or 2 of us talking about the probability of civilians being the first people to find someone after a aviation emergency. Most aviation emergencies are small craft. They end up in the woods somewhere. That's actually exactly what happened. And they were found. One news report that I read said they were found first by a hunter who was out in the woods in the middle of the night. And fortunately, they all survived. I guess we probably should have led with that. We wouldn't be talking about it quite so glibly if things had been worse. But they all survived with some injuries, and we have talked to our mutual friend, confirmed that he's on the path to recovery, and maybe even we'll have a chance to talk to him in the future on the show.
Yeah, it definitely hit home this round because we just did that episode, and then very quickly find out that he was involved in a helicopter crash, and like I said, he did survive. My understanding is that there was a sister helicopter flying behind them and saw them crash into the woods. And the sister helicopter saw where they went down. So they saw some hunters in the woods. And basically it sounds like they did a vehicle takedown on these hunters. That secondary helicopter flew down, said, "Hey, we need you guys," and went in there. So some civilians were one of the first ones with another flight crew to our friends. So that's a huge deal. A lot of people don't survive. So kind of scary. But hopefully would love to get them on and kind of record and get their take on it. I know talking to him, he sounds like he's going to fly again. He wants to at least see what happens, fly again, maybe as a third rider and get back in a helicopter. I would not. I probably would be done. I'll go work at Lowe's or something like that. But he's going to do it. So yes, definitely hit home that we just recorded that. And then civilians are really the first ones that help find the crew and help extricate them out of the helicopter, things like that.
Yeah. So we're really glad that he's okay, and look forward to hopefully seeing his face on here sometime soon. Also, since our last episode, you had a chance to speak at the South Carolina Pediatric Trauma and Injury Prevention Symposium. That is a long name for a conference. But tell me, how was it? Did anybody show up for your session?
Yeah. So I spoke at the South Carolina Pediatric Trauma Association, and I did TikTok emergencies. So I did like all these, TikTok challenges, things like that are like the pepper challenge, the planking challenge, the swatting challenge, all that, and kind of talked about how that affects EMS and, what's, from anywhere from the mental health of teenagers, younger and younger, getting on social media, like how we have a direct correlation to mental health with teenagers and kids getting on social media. Also was able to talk about pain management for kids. We know that kids don't typically get pain management pre-hospital because paramedics are scared that we're going to give too much fentanyl, and we're scared what happens there. So we don't give kids pre-hospital medicine. And then we talked about sedation for kids, like this excited delirium, taking too much Benadryl, things like that can cause kids to be hyperactive, having hallucinations. And so you have to be able to sedate them and have that to safely treat them. So I spoke there, and then we left right after that and spoke at the South Carolina EMS Association's symposium. And I spoke on slow EKGs there. So kind of not my wheelhouse, but it was kind of nice to talk about something different. It was 1:00 on a Friday when I spoke, and the room was full with people standing in the back. So I'll take that. So that was a win for me.
That's great for a Friday afternoon.
Yeah.
All right. So let's talk about some combat sports and injuries related to those. I remember back when I was working before we do that. What's that?
What's your background in martial arts? Like, I want to just talk about that real quick.
Sure. So I've been training jiu-jitsu for about 3.5 years now, and I've competed, I think, 5 times since then. All as a white belt, nothing since I got promoted. That'll change by the time we record another episode. So I train here in Texas where I work and live. I also travel a good bit for work, and I try to train whenever I'm on the road somewhere else. I've found the jiu-jitsu community to be very welcoming and open, and people are usually really excited to have somebody coming in from another gym and checking them out. And sometimes you get people that really want to square up and see what you can do, but most of the time I would say people are just super great. And I spend a lot of time in Minneapolis. I train at an academy up there when I'm in town, and overall I would say it's a fantastic community of people that you can just go anywhere in the world and jump in.
Awesome. So I've been doing it about 1.5 years. I'm a 3-stripe white belt, pretty dangerous. But I have not competed. I'm scared chicken to compete. So I need to pull the trigger on it before I get my blue belt because like if you're not in the community, like I feel like there's a lot of sandbagging in blue belt, especially in the competition world. Luckily, I would be in there with a bunch of old guys too. So, but yeah, I need to pull the trigger on a competition. I just haven't been. I've been pretty lazy, and I enjoy it as a hobby. Like for me, it's a hobby. Like it's good for my mental health. It's good physically. Physical health and mental health, but just not in the competition mode. So, but yeah, I love it though.
Yep. I remember back when we were still working together as medics, that was kind of when I feel like mixed martial arts, UFC, all of that started to become really popular. And there was a recurring competition that happened in our call area, and we had a meeting with the folks who organized it. And they just said, hey, if you have to respond to our event, this is what it's going to look like. This is what happens. This is what you should expect to see. And kind of talked us through what they typically see for injuries, which is kind of what we're going to talk about now. I know where I train, we have between adults and kids, our location has about 260 members that train every month between jiu-jitsu and adult and kid jiu-jitsu, and then adult only Muay Thai kickboxing. So that's a lot of people that roll through. We have a couple paramedics. We have some doctors. There's an anesthesiologist that I train with a lot. We have some physical therapists. And then, your mix of IT and accounting and every other background that you have there, and as well as some aspiring professional fighters. But at any given day, you could be at a class or nearby when there's an injury. We have had some injuries. So, kind of talking through what that would look like depending on the sport. You may be a parent that has kids who wrestle, and that's going to be either officially or unofficially. That's, I think, something that we have to keep in mind as we're thinking about active sports and particularly combat sports and the injuries related to those.
So what do you think about like striking? Like, what kind of injuries do you think we're going to see with that?
I think it tends to be pretty straightforward. You know, if you watch one UFC night of fights, you kind of get a good array of those striking injuries. Obviously, head and face, lots of lacerations, contusions. You typically don't see uncontrolled bleeding. One thing I think I've always noticed, I've watched a few UFC fights with people who are non-medical, and occasionally they'll start saying, that's a lot of blood. Like, do they need to be concerned about blood loss? And I always say, it always looks like a lot more than it really is. Like, you could have a lot of blood and it's really only a couple tablespoons, but it looks like a lot. Typically, I would say we're not going to be dealing with massive bleeding in those circumstances, but you do want to consider blood or teeth in the airway. Those types of things. Mouth injuries can be pretty serious, and of course, concussions and head injuries. If you have any type of head injury, that's an emergency that needs to be treated right away.
So you're thinking like having like ice packs, probably a good idea. Band-aids, 4x4 dressings, maybe some 5x9s. Medical tape's always good to have, I think. Like Coban, something like that.
Yes, and if you have medical tape, you have to hide it because people are going to use it to tape up their fingers before training. So keep some medical tape on hand that nobody knows about that you can use in the case of an actual medical emergency.
Yes. Everyone's always like taping up their fingers and toes and stuff like that. So kind of figure out where everyone's injured.
And you also think if someone gets knocked out and it interferes with their breathing and they've got blood on their face, you're not going to be wanting to give them mouth to mouth. So you want to make sure you have a good barrier device, a bag valve mask or a mask with a one-way valve so that you could deliver ventilations until EMS gets there without actually having to put your mouth on their bloody face. I mean, just look at the average person at the end of a UFC fight and think about whether or not you really want to give mouth to mouth to someone who's just gotten the worst end of a striking competition.
Yeah. And I think about like hand injuries, stuff like that, like the boxer's fractures, things like that, where the fingers are, palms are getting fractured. You have a ton of bones, and I don't remember exactly how many are in your hand in a rough hand, but I probably should since I'm a EMS training officer. But broken hands, fingers, so even splints like the SAM splints that you can roll and make a little splint out of, the splints that you can make finger splints out of, just some small splints can really definitely make someone's life a little more comfortable while you take them to the hospital, take them to urgent care, things like that. So even like a splints, I think some things to think about for this types of injuries.
Yeah, and then so after the head, we also be really concerned about torso injuries. If you're taking kicks to the chest or stomach, that can be pretty devastating as well. Most of the time when you see people in training, they're using padding when they're taking the hard kicks, but you could have situations where I have seen where someone missed the pad and connected with the person, or people that are sparring and just potentially hit a little harder than they expect to. So anytime you're having any impact on the rib cage, you've got to think of fractures that could cause damage to the lungs underneath, cause blood or air to get into the space around the lungs. So if you have someone that gets hit in the chest, potentially a fractured rib, and then suddenly they start to develop shortness of breath and they're having a really hard time breathing, that's definitely a medical emergency that you would want to have them go to the ER for, preferably by ambulance.
Yeah, so you're kind of feeling for that DCAT, BTLS, deformities, contusions, abrasions, burns, punctures, tenderness, lacerations, and swelling. So I do know that. I can't remember how many bones are right there, but I've taught enough EMT classes. I got that one down. But yeah, you want to palpate the chest and kind of feel those ribs, get them to take a deep breath and kind of squeeze as they take a deep breath. Any kind of bruising in the abdomen, chest area, we're going to take that pretty serious because you're not going to get that. You shouldn't have it could be just simple, contusion, but anytime you have bruising across the abdomen or chest area, we definitely would recommend getting that looked at, x-rays, and seeing a doctor. It may something be super simple as a bruise, but it also could be some internal bleeding, broken ribs, things like that. So you'd want to be a little more cautious if you see some bruising, someone's, that tender abdomen area where you put your palm on their abdominal area, and they're super tender to the touch. Like that's going to something that needs to be just evaluated just a little bit more.
Yeah. I mean, I always remember how many times we told our EMT students that you can essentially lose all of your blood volume into your abdomen. So there's no way to see it often other than some bruising. So you have to look at, do they look sick? Do they look unwell? And particularly, if you see some bruising in the abdomen, it's worth looking at and having that looked at, because you can't treat and or even detect bleeding in the abdomen without ultrasound or other invasive imaging.
Yeah, and we're basically limited to vital signs. Looking at the heart rate, elevated heart rate, and some kind of trauma patient is going to kind of lead me down that pathway. Time I start getting a low blood pressure, I'm probably already too late. I'm probably behind the game on a blood pressure. But anytime I have an elevated heart rate on trauma patient, I need to start thinking about why and evaluating why. Is it anxiety, or do I have something going on? So vital signs is really what's kind of leading us, and with mechanism is kind of leading us to think about internal bleeding pre-hospital.
Yeah. Yeah, and then the last category that I would really think of is a little bit easier to detect, and that's extremity injuries. Typically, you'd think of fractures related, like you said, the boxer's fractures in the hand, calf fractures from kicks, if it's kickboxing. We did have a guy at my academy about 1.5 years, 2 years ago who blew out his knee in the middle of training, and just caught a kick the wrong way, and he's back at it. He went through rehab and all that stuff, but it's there's definitely some risk to the striking sports, especially, I think. That said, I've had some conversations with folks about there's a risk to being active and participating in sports like kickboxing and jiu-jitsu, and then particularly for people our age and older, there's a risk to being inactive. So I'll take the risk of being active, and my orthopedic doctor recognizes me when I show up now, but I've managed to stay in pretty good shape because of it. So
yeah, I mean, that's me. Like I broke my hand about 6-8 months ago, grappling. It was a complete accident. Hand hits the mat, and I just hit just right, and ended up with a boxer's fracture there. End up in a splint. So it was a cool story. I was like, yeah, I broke my hand doing jiu-jitsu. I'm pretty badass. But no, I'm 180 pounds. I get to eat what I want to eat. I get to do what I want to do. So I grapple 3 nights a week. And I actually saw that I was losing weight. So I really had to start watching my protein intake and watching my calorie intake because I was losing weight and I didn't want to lose. I like being that 175, 180 range. So I had to watch that. So yeah, no, I would rather, there is risk in it, but risk versus reward. So I love it. I think it's great. So I'd rather take the risk of getting hurt.
Well, there's a reason you go by the name Skinny Medic. I don't.
Yeah, I'm like, now I'm
going to have the problem of being like, oh, I got to eat a lot to stay in that 180 range. But for jiu-jitsu, the key is you want to stay at 222 or under, because if you go to competitions, typically that's the line. As 223 and over is the unlimited weight class. And so if you're like 225, you're in big trouble because you're going against guys that are like 300, 350. You don't want to be in that weight bracket if you can help it. So fortunately, I'm not in that weight bracket, but I've managed to keep myself under that. I have lost, I think I'm down about 20 pounds since I started jiu-jitsu without really making a lot of other lifestyle changes. So there's definitely some value to that. And I train 3 to 4 times a week, depending on travel schedule and kids and all their responsibilities. So let's move on to jiu-jitsu and talk about that. So grappling sports, we have jiu-jitsu, you have judo, we have, if you really, high school wrestling, college wrestling, sports like that. Typically, I think what you're going to see is those are submission based, or at least jiu-jitsu and judo typically focus a little more on submission. So you're going to have choking and joint locks are typically the submissions that you get. So for choking, I think most people kind of think of choking as cutting off your airway, but in jiu-jitsu and other grappling sports, the choke that we commonly see is a blood choke where you're cutting off circulation to the brain. Mm-hmm. There's some debate about whether we're actually cutting off the carotid arteries and we're cutting off circulation to the brain, or we're cutting off the jugular veins and that return from the brain. And so overloading the brain with pressure, causing you to black out. So there's some debate over which you're doing, and it may depend on which actual choke you're applying, which you're doing. But either way, pretty typically we see blood chokes resolve quickly. I don't know if you guys have had anybody at your gym that has not tapped when they should have tapped and got choked out. We had one guy that recently was training he was in a choke, he was defending it, and the instructor was standing by him and said, "There's only 10 seconds left," and so he tried to tough it out, and he didn't make it. But that typically once that choke is applied, unconsciousness hits if it's a good choke 5 to 10 seconds later, and it usually only takes about that much time for consciousness to reoccur. So those tend to resolve pretty quickly, unless there's a longer choke, or like sometimes people will find themselves in a not quite sufficient choke to knock them out, and they kind of try to power through it for a while. I do know of a guy, he didn't train at my academy, but he's friends with us here in the Dallas area. And he actually had a small stroke because he was kind of hovering in that almost unconscious range for a while. And his doctor theorized that his intracranial pressure was so high because of the choke that he eventually had a small stroke related to that. So my advice would be tap early, tap often, live to fight another day. And but those are things that can certainly happen. So anytime I think someone goes unconscious for any reason during training, they need to be evaluated, and they should be done for the day.
Definitely. Yeah, I haven't. Yeah, I've seen like stars start to pop a little bit because it happens fast, and I'm like, oh, there's some stars, like But I'm tapping early, tapping it quick. I did one of our guys that's a blue belt. It's been a blue belt for a while. He's bounced from different gyms, and he's on social media too. He does a podcast. Okay, Shooter is what his podcast is. So like he'd been gone for a few months because he'd been at an NRA show, a couple of Second Amendment gun shows and all that, and has been missed a while. So he came back, and I was like, all right, man, I've got like 3 to 4 months training in now. Like I'm ready to go. And so he's there. I lay a solid triangle choke in, and like I've got it cinched, and I see his face turning red. And he was able to get out of it. And I was so mad, but he was like, I was not going to tap to that. He was like, I was not going to let Skinny Medic tap me. You're going to choke me unconscious. And he'd already decided I was. And I was like, man, if I'd have choked you unconscious, I'd have got my camera out and like snapped a picture. If I'd have choked you unconscious, that I would have took a picture on social media. It would on Instagram for sure.
For sure. Definitely get that selfie.
So what about like joint locks, arm bars, like shoulder locks? Man, arm bars make me super nervous. Like I will tap as they're coming down my arm. I'm going to tap because we were actually working on it last night. We were doing from close guard and from back doing arm bars. And man, like you have to nail them quick. Like to me, like if you're going to throw an arm bar, from mount, close guard, if you're going to throw an arm bar, it's going to be quick because I can pull my arm down and get it below your pelvis. And the moment I get below my pelvis, I can get it out.
Right.
But they throw them so fast, and like we've got a couple of young kids, like they are stronger than me, they're faster than me. So to me, arm bars scare me because when they start throwing them, like they have to throw them fast. So I will tap when my arm is coming down. I'm going to tap to an arm bar.
Yeah, tap early, tap often. When you look at the joint injuries from someone who doesn't tap or the fractures, and there's a lot of videos that go around on Instagram and Reddit, on jiu-jitsu forums. Particularly in competitions of people who just refuse to tap. I saw one this morning of an Americana that ended up in a forearm fracture. Yeah. And I just think it's never worth it. You're not fighting for $1 million. You're fighting for a $5 medal. I've got a few, but they're $5 medals. So don't risk your joints. That recovery time is too long. So yeah, I would, have a high index of suspicion. Someone has joint pain, shoulders, wrist, ankle, after having a arm lock applied or a joint lock applied. I would do a very thorough assessment and potentially recommend them for an X-ray.
So you're going to look at the arm, look at the elbow, like it should look normal. If it doesn't look normal, then definitely think about getting an X-ray, putting ice packs on it and position it, sling and swab, something like that. But yeah, like you're going to look at it and you can kind of like, do they have full range of motion? That pulse motor sensory is what we're looking at when we're doing the exam. But joints, arm locks, man, those, like I got a couple of guys too. They're a couple of bigger guys. So like their shoulders are really like stiff. So like I love attacking their shoulders. Like I'm going to try to do like a head and arm choke or something like that. I know their shoulders are so weak. But yeah, arm bars are my weakness. So when you come down June-ish, whenever. So yeah, I'll be defending the armbar heavy.
You said when I come in June, you want to live stream us rolling, right?
Yeah, let's do it.
On Instagram? Yeah, we'll do that.
Yeah, we'll set my camera up, set the podcast up. Yeah, we'll live stream it. So you kick my butt. I got a couple buddies for you. So
that'll be fun.
It's always like, this goes back to high school. Like, I've got a big mouth, but I got some big guys behind me. So I'll run my mouth, but I got this guy. He's like, his name's Jay. He's a state trooper. He's like 220 pounds. Like, he's going to get you.
All right. So we talked about chokes. We talked about joint locks. We're not supposed to slam people in jiu-jitsu, but it happens, particularly with takedowns. With takedowns, it's a little more acceptable because you can't just lower someone gently, and you shouldn't be pulling guard all the time. So, particularly in other sports like judo, where takedowns are kind of the goal, there's a high probability of people getting slammed to the ground, and usually with people who are trained and have some ability to reflexively respond to what the other person is doing, they know, you don't put your arm behind you, you tuck your chin, so you're not going to hit your head. But accidents happen. So always have an index of suspicion for head or spinal injuries if someone gets slammed really hard. I saw one video recently of a teenage girl who got slammed in a competition and ended up with a pretty severe concussion and had to be in the hospital for a while. And, there's pretty strict rules against that, especially in competitions, but it can happen. So I would be looking at your normal signs and symptoms for head injury, confusion, headache, blurred vision, particularly with the back of the head impacting the ground, things like that.
Yeah, definitely. And like I said, the mats are padded. They're not super padded. But they do have some padding there, which kind of helps. But we practice falling, like how to fall, like how to, but not put your hand behind you, but like to slap the mat, things like that. So, but like you said, and I'm a white belt, so I pick on white belts. It's that white belt that's spastic that, a lot of times
we all pick on white belts.
Yeah. And for like, even as me, like I've already seen myself, like if we go make that throw, I can make that throw and still a lot of times guide you to the ground. Like it's not a full throw, but if I can grab you and just assist you to the ground, I'm going to do it. But just knowing how to fall. So you get that spastic, 19-year-old kid that wants to do a double leg takedown on me. He's going to drive me all the way to the wall. So time you do that, I'm like, all right, cool. I'm going to go down. Like if I got a 19-year-old kid that does a single leg or double leg, I'm like, all right, let's just fight from the ground. Like you've got me at this point now. So I'll go to the ground and we'll start from scratch. So we did some judo stuff before. I felt my back super sore even afterwards, like even like starting to learn how to fall, stuff like that. So, but anytime someone falls and you have LOC, loss of consciousness, we definitely need to have them evaluated and high index of suspicion that we have a head injury or something like that occurring.
Definitely. Yep. Especially, I would say, especially with kids, you want to make sure that anytime you have a suspicion of a concussion, you get them evaluated early. And, if you do have an evaluation and then they leave and go home, or if you don't get an evaluation and you go home and you have, significant headache that doesn't go away, if you have any vision changes, projectile vomiting, I think is always the classic head injury symptom. It should be self-explanatory, but that's just like really powerful vomiting as the body's trying to is malfunctioning in a way that's wanting you to evacuate your stomach quickly. Those are things to think about afterwards and identify as this is an emergency. This injury is not resolving, and we probably need to go back and get evaluated at the emergency room.
Yeah, and we've come a long way with head injuries and stuff like that. Like a lot of sports, professional sports, things like that have come a long way with head injuries. Like I remember I had a concussion as a kid, and like I remember walking around. I don't remember, but my mom told me like I was walking around Walmart just asking repetitive questions. Like my mom took me to my family physician. He's like, "Oh, it's just a concussion," and she said that I asked repetitive questions, and I lost the whole day of my life there. But we've learned that it's not just a concussion anymore, that, concussions can be dangerous, especially repeat concussions, how much long-term damage they can do.
Yeah, absolutely. I had one about 10 years ago now. I was driving in Italy, actually, and I got into a car accident. And I really don't remember much of the next 24-hour period, particularly the next day as I was taking a bus back to where I'd started from. And it was all a blur to me. I got about 2 days post the accident and kind of just looked back and said, oh, crap, I don't remember anything that just happened.
Dang it.
That's a bad sign.
Yes. Dang it.
I got 3 brain cells left and one of them's damaged. So if you're thinking about, I say, I train or my kids train, what would you say you would think about for preparations for treating medical emergencies at a combat sports academy?
So we kind of talked about a little bit. I think ice pack, some bandaging supplies, some splints maybe. And like for a kid, like I would think about some pain management, like Tylenol, ibuprofen, things like that. Obviously, if you own the gym, like I wouldn't just be handing out Tylenol, ibuprofen to everybody. But if it's your family member or friends like that, I think having that is perfectly acceptable. Yeah, so ice packs, splints, bandaging supplies, pain meds. What else you thinking?
Well, as the resuscitation guy, I would say you need to have an AED.
Yes.
Particularly, you think of people that are exerting themselves. Really, I think the biggest lesson for me when I started training was finding there's always kind of a limit of like, oh, this is as much as I can exert myself. You think of, going for a run and you're running and you kind of hit that wall where you're like, all right, I just don't have any gas left in the tank. But when you start doing grappling sports, particularly for me, I'm very competitive. And so I kind of found a second and a third level, but I know that there are definitely days where I'm doing conditioning work grappling because I'm pushing myself to the absolute limit that my cardio can. And particularly for guys our age in our 40s and above, that's something you really want to consider. So I would say absolutely you need to have an AED available as well. And tourniquets are cheap, so you should have a good tourniquet in your kit everywhere. There's not a whole lot associated with combat sports that could cause life-threatening bleeding, but it is possible. You could have an open fracture or something like that would require a tourniquet. So I would always recommend to have one of those as well. And then, of course, the right gear is only good if you have the right training. Make sure your staff are CPR and first aid certified, and if they have the opportunity to do a stop the bleed class and some things like that to deal with life-threatening trauma, that's important as well.
Yeah, I think a basic first aid class, a good first aid class would be appropriate. And like I was talking to our gym and I was like, hey, like even doing a stop to bleed class at the gym can bring people in. You kind of use the medical CPR stop to bleed for the community, but then you bring them into the gym and you see that it's not just a bunch of meatheads, jocks that are doing this, but it's, like you said, IT people, accounting, we have police officers, we have nurses. So it's a wide range of people that, so if you bring them into the gym, they kind of they've seen, UFC, like the blood and all that stuff. And that's what they're expecting to go into a gym. When you see it's just a bunch of men and women who have regular jobs who want to go to the regular job tomorrow. So it's a little bit different. So using that as community outreach is huge.
Yeah, I agree. And then I think the last component is to have that emergency plan. You should do that with any organization. We've talked before about churches and houses of worship on a previous episode. And, I think there's, whether you run a store, whether you run a regular gym or a martial arts or a combat sports gym, it's important that you have an emergency plan. Wherever your desk is with the phone, you need to have the address written there, taped to something, because you're not going to remember that address under pressure when you're trying to call 911. You need to delegate someone to go outside and wave down the ambulance. You need to know and have somebody there. Anytime somebody's there, there needs to be at least one person who knows where the AED is, where the first aid kit is, and have that plan in place so that you can respond appropriately if something goes wrong.
Yeah, that's all great points.
So I think that's kind of the professional side of like, what do we do to treat injuries related to martial arts? So now we can talk about the fun part, which is should you do it as a first responder?
And
so I think there's. Go ahead.
Yeah, I can jump in there and say absolutely. I think you should. I think as an EMT paramedic, you should know how to be able to control your patients. You can control them without hurting them and hurting yourself. So I think that's a big deal. And I think if you're a police officer, it should be mandatory.
I agree. We have several officers from different departments that train at our academy, and I see how good they are, but then I think about how good the average person is when they come in and they first start. After you've been training for a few months, when you feel like you're not making any progress because everybody's beating up on you, but then some new person walks in and you can just absolutely destroy them. You realize a few months of good grappling training makes a massive difference. And I think all law enforcement should be required to do that training.
Yeah, we had a guy recently who had missed about a year. He had knee surgery, things like that. Super strong dude, but has missed about a year. And like you said, it's kind of that same mindset. Like I grapple the same group 2-3 times a week. So like I don't see the progress until someone new comes in. And so we had a guy recently come back into our gym. I've been gone a year, and we were doing open mat last night, and we're almost done. He's like, "Hey, you want to go?" I was like, "Sure." And so we were starting from the ground just because there's so many people in the gym that so immediately was like able to pass his guard and get into side control, and I was like, holy crap, like this is a big dude and I'm able to control him. And so like I was like having some fun. So like I put all my body weight into him. Like I'm up on my toes because he's got me by like 50 or 60 pounds. So it's almost like I'm picking on a small dude. And so I was able to get on my toes, put my chest on him, get side control. And I was like, oh gosh, like I have him, like this is it. So kind of worked some submissions. I got an Ezekiel choke on him, but I was like, that's it. Like you see that. So kind of same thing. Like you don't realize how much better you're getting, even like a year and a half, 2 years in, until someone new comes in, and even they're stronger, younger, and you can control them. Like they can't pass your guard, or you're just able to pass their guard and move through. And like it is amazing the difference I've made. Like I've said myself, like I've told our guys, like I wrote down the dates on my stripes that for my white belt. And that's for me, that's a reminder of progress, because I am not by far the best guy in our gym. Like I get my butt whooped every single week. But what I would love to do is go back and fight that Dietrich from a year ago or a year and a half ago. I'm like, man, I'd love to go fight that guy. Like I want to go fight Dietrich 6 months ago. So we had a patient fairly recently that had a seizure. We're in the back of a little small camper. He's in the bed part of it, and he's combative. And he doesn't know what's going on, so no fault to his own, but he's post-ictal, he's combative, and he goes to start swinging. And it was only a couple of people in there, and so I immediately grabbed his wrist, was able to take control of him, and just hold him just for a second till we could get some more help in there to get him out. But I think like that was it. Like I felt completely comfortable grabbing a hold of him and controlling him, and that's all from jiu-jitsu. And I think, people have said like you've never felt helpless until you had a black belt from jiu-jitsu grab a hold of you.
Oh, and wow, yeah.
Yeah, like you have no idea. Like our instructor is a black belt. He's a first degree black belt, and to completely feel like a little kid grappling with him. And so like, and he's been doing it for 20 years. I've been doing a year and a half, and I felt comfortable with a civilian grabbing a hold of them. Now they've got training. Obviously, that's another thing, but to be able to have that confidence that if you've never had someone grab a hold of you that could physically hurt you, like it's a humbling experience.
Yeah. Yeah. And I think, for those of us that grew up in the 90s, we kind of watched a lot of like Kung Fu movies and Walker, Texas Ranger and all that. And kind of got our mindset was like, oh, well, if you're going to learn to defend yourself, you need to learn a striking sport like Taekwondo or something like that, which by the way, Chuck Norris turned 85 yesterday.
Still wouldn't fight him.
Still wouldn't fight him. But, I think the benefit that I see now to grappling, particularly for first responders, is that you can control somebody without necessarily causing them injury. You do have joint locks, you have chokes at your disposal, but you also just have the ability to control someone for a period of time until law enforcement shows up or until you can get back up. Or in the case of EMS, chemical restraint is always a next level that you can go to. And even if you're thinking of just outside of just controlling, but if you're involved in an altercation where someone attacks you, most fights end up on the ground anyways. So there's really a great benefit to being able to dominate that fight once it goes on the ground. So I think for law enforcement, for EMS fire, and for anyone else who's working in one of those adjacent first responder roles, I think it's an absolute must. I do remember one particular time when I was in EMS, I was working with one of the supervisors, and we responded way out into the country, and for a psychiatric emergency. And we rolled up with one sheriff's deputy, and the guy that came out of that house was big, and he came out ready to fight. And the three of us scrambled for a long time. The officer called for backup, and I think it took over 20 minutes for the next deputy to get there, which, that region, it happens. That's not unheard of. And there was a lot of scrambling going on, and I remember afterwards how anxious I was because I felt like that one person against three of us, we were not winning most of that time. And he didn't get cuffs on him until the second officer arrived, and it was 4 against 1. And I do remember getting a call from the person I was working with at the time a few days later, and he said, "Oh, by the way, that guy ended up with a broken arm after all that." So as I look back on that, I can't help but think, man, if we'd had some better training in grappling, if I had the training I have now, probably could have resolved that a little bit more amicably for everybody, without having to, have someone get injured or have us be afraid for our lives for a while. And it's possible in many cases that, if that officer had been by himself and had not had a couple extra people there, that he may have had to resort to lethal force. So, there's a lot of benefits for self-defense, for training and grappling.
And it's interesting too, like no one realizes how long 3 minutes is. I mean, I know it's a little different than your honeymoon, but I'm like, 3 minutes is a long time. Yeah. I tell Candace that all the time. I'm like, 3 minutes is a long time, babe. You should try it. But you see these boxers, these MFA fight, I can't talk. I'm having a stroke. UFC fighters, 3, 4, 5 minute rounds. Like that's a long time. Like, so you're thinking about your backup and you're being 20 minutes away. Like to build a grapple that is a long time. And I remember like a year and a half ago, we started, I did a 2-minute round and was like, holy crap. Like this is a different type of cardio. Like I enjoy running. I enjoy being outside, hiking, but that's a different type of cardio. And this past year, we grappled for an hour straight. I picked one partner and we were to grapple for a solid hour. Now we did kind of come up and like take some breathers, but for the most part, we grappled for an hour. Now it was more like flow rolling, or we weren't going 100%. But to be able to say you can grapple for an hour, like that was a big deal. So that was a big achievement for the first year for me.
Yeah. Oh, it's a great workout. Some of the places that I've trained do like 90-minute classes where you just train. You do your typical training for 30 minutes, then you just do an hour of grappling afterwards. Sometimes 10-minute rounds. And for a 40-plus-year-old guy, that's a lot. And it really, really wears you out. And it also gives you an appreciation for how long 10 minutes can feel if there's no end in sight. So yeah, I would say for the health perspective, cardio, it's great cardio, it's strength training. You can tell when you start grappling with someone who's been doing it for a while by how strong they are. They just feel like a rock. There's a lot of muscle, even if they're not in like, they don't have a 6-pack necessarily. They may be built like me, not like you, but you can still tell when you start competing against them, you can feel that there's a lot of strength there, a lot of core strength, and they have a lot of balance and coordination that you wouldn't expect from a normal person. So I think there's really a lot of different benefits from that because you get great cardio, it is strength training, and you get some good balance, some good coordination. You learn to fall appropriately. Obviously, I think if you can complement it with some other cardio, I think particularly running is a good one, or I'm sorry, swimming is a good one because you have to, it's a full body workout. Plus you're also controlling your breathing at the same time, monitoring your breathing, very similar to what you're doing when you're grappling. So if you have access to a lap pool, I think that's a good compliment. And then, there's also some interesting research I read recently where they were saying that for long-term health, for physical health, and for prevention of dementia, actually, they said there's really good research that exercise is beneficial, but not repetitive exercise. So yes, running is good for you cardio-wise, but if you start thinking about maintaining good brain function late into your years, that is better to do a physical exercise that requires concentration and is unpredictable. And so the example that the author used was dancing, because you're using balance, you're using coordination, and it's also some cardio. But I think all the benefits that you could possibly ascribe to dancing are even that much better for a grappling sport where you're competing against other people. So, I don't know how long I'll be able to do it in my life, but I certainly plan to do it for as long as I absolutely can.
Yeah, we've got a couple of guys like in their 50s and 60s at our gym, and they are more of the slow, like they're not explosive. But I think one of the guys, I think he's like 62, 63, and he's a purple belt. But man, he's not explosive. He's just going to grab a hold of you and just start easing into things. And like the next thing you know, he has a choke on. You're like, where the heck did that hand come from? I never felt it. So just, slower rolling, slower movement, but you're using your whole body. Like I'm trying to get my knee to my elbow, flexibility, like hip mobility. I'm framing with my arm. So like is a full body workout. And like you said, we do the same thing. We're about 30, 45 minutes of techniques with warm-ups and reviews and techniques. And then we'll grapple for 30 to 45 minutes, whether it be 2-minute rounds or 5-minute rounds or 10-minute rounds, kind of move those back and forth. But yeah, like it has been great for my health. And, guys, like I said, I've said it early in the show, like I was losing weight and Candace kind of picked up on it. And she was like, all right, I don't think you need to lose any more weight. So like, all right, cool. Let's increase my calorie intake. Let's increase my protein intake. I stopped going to the gym just because I feel like that was leading me to more injuries, like actually lifting weights. I know guys who do it at our gym, which is great. For me, like I can't do that. I can't like do jiu-jitsu every other night and still lift weights because I feel like I was getting more injured that way. So going for a walk, going for a run, going for a swim is able to do that. Because I kind of do that my days off, do something, stay mobile. But for me, like I had to stop going to the gym, and I justify my brain by going, okay, I'm still using all those muscles, at jiu-jitsu, whether it be squatting, using my upper body, things like that. So I kind of justify it that way. I don't know if I'm right or wrong, but if I was 19, 20 years old, heck yeah, I'd be going to the gym in the morning and going jiu-jitsu at night. But I'm not there anymore. So my mind thinks so I am sometimes, but physically my body, I'm not there anymore. So I think that's a big deal. But like you said, strength, your balance of coordination for my mental health, it has been great for all of those. My mental health, like we've twice that I can think of after some major events here in our county or just at work, I've come in there and like, hey, Bruce, like, can we just grapple tonight? And he was like, sure, like, let's just grapple. And so we kind of switched, and we have a couple of first responders in our group, and he's did that before. Like after Hurricane Helene came through, several of our first responders spent, a week away from their family. The gym was closed for a week, and we came back and we're like, man, we're just mentally done. Like we just want to grapple. And Bruce completely changed the night to let us grapple. I had a difficult call, and like I came in that night, and Bruce, I guess, could tell something wasn't right. And I was like, I just had a bad day, had a bad call, and gave him the PG version of the call. I was able to talk to him. He goes, so you just want to grapple tonight? And I was like, yeah, like I just want to beat the crap out of you tonight. And he goes, good luck, let's go. And so able to do that. And that's what I appreciate. I've got some of my friends that are, 200, 220, 240 pounds that are bigger, stronger than me, that I'm able to go 110% against them. And they just laugh. They're like, okay, cool. What are you doing, DJ? Stop that. Obviously when you grapple with the women, the younger people, like I'm not going 100%, but with those guys like Jay, like he's a police officer. I'm able to go 110% against him. And he laughs. He's like, all right, cool. Like, all right. Like he will go into a bad position and let me fight into it. So that's great for my mental health. Like I'm able to get rid of that frustration for an hour and a half. I don't think about anything else but not getting armbarred or not getting choked. I don't worry about what's on the cell phone, the active 911 going off or the emails coming in. So for my mental health, it's been huge.
Yeah, I agree. For me, it's a lot of people talk about meditation as being able to like focus on one thing to like get your mind off of all of the other things in life. And for me, there's nothing better than starting to roll with somebody, because you don't have time to think about all the drama that's going on in life. You don't have time to think about politics or family dynamic or anything else that's going on at work, because you're trying to not get choked. So it really has the ability to force you to think about one thing, and I can walk into class and start, and then an hour later realize I didn't think about anything bad in the world for an hour. I just trained. And that's not something that I find myself doing in any other type of exercise. If I go running, if I go swimming, if I'm lifting weights, I have all of that stuff is in your head. And my gym has TVs on, so the news is on, and there's just no escaping all of the other things in life except for that 60 minutes at a time on the mat. So I think that there's really a lot of health there. And then I think, from a perspective of jiu-jitsu as community as well, I kind of alluded to that earlier, that I pop into a bunch of different academies when I travel, and I've met a lot of different people around the country and overseas as well, training. And it's just a great group of people that I've got to meet and train with. So the people that I train with here, I see them more than anyone else other than my family. And sometimes our conversation has never gone deeper than jiu-jitsu, but some of them have become really good friends, and I feel like it's been a really good area for me to get plugged in and meet some folks as well.
Yeah, definitely. I mean, I think about community. Like I've had great friendships that went through jiu-jitsu, and like one of the guys, his wife, their husband and wife, they do jiu-jitsu, and he called me one night. I was like, "Hey, she needs something. Do you mind? I'm on." And he was busy. He's a police officer, and he's like, "Hey, my wife needs something." I'm like, "Yeah." She thinks someone banged on the window. I'm like, "Okay, sign me up for that." Like, I'll go over there. She thinks someone's in her yard that need to be there. So just that community, that friendship, that you're willing to do stuff outside of jiu-jitsu, like go to dinner and go to lunch. So definitely exciting.
Absolutely. So June, I forget the week. I'll let you know later. I'll be over in your neck of the woods for a week. So let's do a couple classes, and we'll live stream at least one.
Yeah, I got the camera set up. We'll set the little tripod up and record it. So we'll see what happens. So, I mean, either way, I'm good. Like if I beat a blue belt, a competition blue belt, like I'm golden. If you whoop my tail, I'm like, sorry, he does competition. Like I'm just a hobbyist. So I am good either way on this. So like I was like, he's a competition blue belt. He's been doing it for 3 or 4 years. So let's do it. I'm excited.
Sounds great. I'm looking forward to it as well. All right. Thank you very much. And we'll be back in April with a new topic.
Awesome. I'm going to play the outro music real quick, and then we'll go.
Find us and subscribe at civmedical.com.